Hello, everyone. Good evening. Hi. Good evening again. It's Thursday, and we are here again for another session of the delegation and prioritization questions. So, tonight we have prepared questions again for all of you guys, and the date today is July 9, 2020. And again, without further ado, I would like to introduce myself. My name is Mr. Alan Matus. I'm the nurse educator and also the president of Matus Nursing Review and Matus Nursing Review Online and Class Academy as well. I have been teaching nurses for 25 years. I am a U.S. Nurse educator. I practice as a nursing faculty in one of the schools, and also I have been teaching NCLEX for a long, long time. So for tonight, we'll be discussing again some questions and a few announcements regarding our program. But before anything else, I would like to say hi to our students and our attendees for tonight for this session again on Facebook Live. And the focus of our questions for tonight will be on prioritization and delegation regarding or covering topics on the urinary system. So regarding urinary system. So how good are you in concepts about the urinary system, everyone? So participate, and of course, we'll be having a great time tonight, hopefully. Okay. So I would like to welcome some people before I proceed. So let's see who's gonna be here again tonight. So okay. So Regine De Liomas Daria. So good evening tonight, and thank you very much for joining us. Okay. Also, Alan Hill Torres. So she's one of our students now in the online NCLEX Academy. And can you please tell me as well, from what country are you coming from, everyone? I would like to know if you're coming from different parts of the world, okay? Because our session actually is international. So, anybody can join this session, guys. And I hope that you'll be learning something tonight about delegation and prioritization. Okay, so interestingly, so Menchi said that I hope my book was signed by you. I know, yeah, I forgot that. I should have signed the book for you, the workbook, right? But I do have my cover page with my signature, so you have that. So, but that's a very good idea. I forgot to sign the book that I sent to you. Also from California, Alan, Rich, of course, is from Nevada. Okay, so before anything else, everybody, I would like to announce to you tonight. Okay, we have we have our ongoing free 90-day online NCLEX review. So whoever attends tonight will be qualified for the drawing. Okay, so meaning that you'll be able to win free 90-day online access, okay, in our Matus Nursing Review Online NCLEX Academy. And congratulations to Rich Maki. The last time she's the winner for this. Whoever wins tonight will be put in the website for the drawing, and then we will announce the winner. We will announce the winner next week in our next Facebook Live. Okay, so we'll announce the winner next week. So that would be interesting that we will announce the winner for this free 90-day online access and NCLEX review, everyone. So I hope you're all excited. Okay, so another announcement, just really very quick, everybody, that would be, of course, I'm going to have another 1 hour free NCLEX review. The purpose of this 1 hour session is just to get to know the students, whoever is interested with our program. So this is the time that I will be able to explain to you what are the different programs that we offer, and you will meet me through this webinar as well. So sign up at our website, Matus Nursing Review Online NCLEX Academy, and you can sign up for this free webinar on July 13, 2020 at 8 p.m. Pacific time. Okay, so I hope to see you there, guys. Another announcement, and this is a big one, everyone. So this will be UWorld. Yes, so finally, we have UWorld Q Banks. Okay, we offer this now as part of the package, and oh my gosh, we have a lot of students who have been emailing us to be part of this package. And thank you very much, everyone, because we're offering this to you now, and I'm able to monitor as well your performance. So I have the access to the faculty portal. So I'll be able to monitor your performance and, of course, to support and encourage you. So thank you very much for supporting this. And, UWorld is one of the most trusted resource out there, and It provides the best questions and explanations, and of course, NCLEX-like practice questions. So we're offering this now to the students. So that's really very nice. Okay, so we have someone, I just saw this. Aldrin Sinlao is from KSA. Okay, so thanks for seeing you here, Aldrin, and I hope that you learned something tonight. You all know that I specialize in prioritization and delegation. That's one thing I want to help students with, because I know most students have problems with prioritization and delegation questions. So I specialize in this. I really worked a lot on making sure that I'm able to teach students the basic concepts on prioritization and delegation. And thankfully, I have students who have come back to me and said that they were able to pass their NCLEX because of this session that we do every week. Okay, and thank you very much also everybody for being here tonight, and sticking with me, and always listening and looking forward to this Facebook Live, everybody. So can I have a big yes from everyone if you're ready for our first question for tonight? Okay, so I have prepared exciting questions for you. As you know, I'm a certified nurse educator, and part of my training is to really understand and know the basic principles in test question formulation or creation. So that's my specialty. So I like making questions. All right. So tonight, okay. So let's have the first question, everyone. And as what I have said, the focus is going to be on your nervous system. So the first question that we have is going to be prioritization of 4 patients. As usual, I told you that in the NCLEX, you're going to receive questions wherein you will have 4 patients and you have to choose which patient comes first. Okay, so let's proceed and have this question, everyone. Okay, so the nurse is caring for clients with renal failure in the outpatient dialysis clinic. Which of the following clients should the nurse assess first? Okay, or which patient needs attention? A, the client who appears pale and weak. B, the client who complains of pain in the shunt site. C, the client who reports recent weight loss and poor oral intake. Or D, the client who has cough, fever, and chills. Okay, so which patient should be assessed first, or who needs attention? Is it the client who appears pale and weak? B, the client who complains of pain in the shunt site? C, the client who reports recent weight loss and poor oral intake? Or D, the client who has cough, fever, and chills? And can you please give me also your rationale, everyone? Why is it that you chose a certain letter as the answer to this question? Okay, I would love to hear your rationale, because sometimes the answer is correct, but we need to find out why is it that you choose a certain answer. Okay, and obviously most of you actually answered letter D in this question. Okay, most of you answered letter D, so you might be surprised if D is not the answer. So can you please write how many percent sure are you that D is the answer to this question, everyone? Okay, how many percent sure are you that letter D is the answer to this question? Okay, 100% sure? Let's find out the answer, everybody. Okay, all right, so someone said infection. Okay, the answer to this question, everyone, is very direct to the point. Yes, you're all correct. That would be infection, everybody. So congratulations, guys. Infection is the answer. This is a straight to the point question, and you get these kinds of questions in the NCLEX. However, this question may seem easy. However, if this is a question that you miss in the NCLEX, then it's a big blow to your score or to your performance, because this is a question that most nurses will be able to answer. So definitely infection, because if you have dialysis or hemodialysis, these patients are prone to infection, sepsis, not only the overall sepsis, but of course shunt site infection. So respiratory infections as well, because of the entry of bacteria into the bloodstream. Now, A is not the answer, because most patients with renal failure may have anemia, appears pale and weak, and there's no indication that the patient is unstable. Letter B, pain in the site could be a problem, but then that is something that could be the next one that could be assessed. So C, recent weight loss. If you'll notice something, all of these patients seems to have a problem really, but you have to rank which person comes first. And when you're doing prioritization, I would like you to write this down, everyone. Write this down. When doing prioritization, number one thing you have to ask is, are these part of signs and symptoms? Okay, is this part of the sign and symptom of the patient? Therefore, it is not a complication. That's the first thing. You have to ask yourself, is this part of the symptom? If it is, then I don't need to be worried. Okay, so it's part of the symptom. It's not a sign of complication. Okay, now, then you have to do your A, B, C, of course, your Maslow. So you're going to have your airway, breathing, and circulation, especially airway that comes first, especially if it's respiratory distress, for example, or airway problem. So airway, breathing, and circulation. So you write airway, breathing, circulation, A, B, C. And then you add letter S, that would be safety. Okay? Safety or injury issues. So safety, and also under your safety, infection. Okay, so infection. So letter D is infection, and infection is a priority. Okay, if you have an airway issue there with one patient, then airway issue will come first. However, safety, infection is also a concern. So that's why letter D is the answer. Okay, so don't forget infection, and don't forget A, B, C is infection, and then N would be neuro. Okay, neuro, you add neuro, everyone. So a patient who has a changing level of consciousness, somebody who is deteriorating, the alertness, becoming confused and like that could be a priority patient. Someone who has a changing level of consciousness. So don't forget neuro also, everybody. Okay, so let's proceed, everyone. So good answer, everybody. Okay, so we have a rationale from Audrey. He said that renal failure patients are somehow immunocompromised, and that's another reason, because they are immunocompromised, they're prone to infection, and that's why the focus is how to detect signs of sepsis and, of course, generalized infection. Very good rationale. So let's have the next question, everybody. Okay, so this one will be again for patients that you need to see first, or which patient will be a priority. Okay. The nurse is receiving the following clients in the nephrology clinic. So which client should be seen by the provider immediately? A, the 60-year-old client with end-stage renal disease or ESRD who reports insomnia, muscle cramping, and difficulty urination. B, the 48-year-old client with bladder cancer who reports persistent blood in the urine. C, the 54-year-old client scheduled for hemodialysis who has a recent creatinine level of 1.8 and a BUN of 29 milligrams per deciliter. Or D, the client with chronic renal failure who has a potassium level of 6.5, fatigue, and palpitations. Okay, so let's see what your answer is going to be. All right, so what's the answer, everyone? A, B, C, or D? Okay, so which client needs to be seen by the provider immediately? So these are 4 patients sitting in the clinic, and then you see all of the symptoms. So which one do you think will be your priority at this time? Okay, so always remember, read each option and see which one comes first. Okay, if you answered letter D, why are the other options not correct? Okay, so let's proceed. All right, so you're all putting your answers, everyone. It seems that we have a consensus over here. Okay, so I think you're all getting smarter and smarter every week. Okay, but always remember, these are some of the questions that you will have in the NCLEX, but in the NCLEX, as you move further towards passing, the questions will be more difficult. Okay, all right, so let's proceed, everybody. The answer to this question, okay, is going to be letter, okay? Very good. That would be letter D, everyone. The client with chronic renal failure who has a potassium of 6.5, fatigue, and palpitations. Can you let me know why A is not the answer? Why is B not the answer? Why is C not the answer, everyone? What about letter C? It's abnormal. Your creatinine level is 1.8, and your BUN is 29. But why is letter C not the answer, everyone? Why is it D the priority? Because Hilda said that letter D, okay, risk for dysrhythmia. That is correct. Your normal level of potassium, okay, your normal potassium level is 3.5 to 5 milliequivalents per liter of blood, okay? And what you have there is 6.5 milliequivalents per liter, which is moderate hyperkalemia, okay? Moderate hyperkalemia. And the patient is also symptomatic, so you have fatigue and you have palpitations, and we all know that hyperkalemia can lead to cardiac dysrhythmias and cardiac arrest. So the fact that this patient has a fairly high level of potassium, that would be concerning. Although we will say that, of course, patients with renal failure may have hyperkalemia, as a part of the problem. But remember, this is 6.5. It's really very high. And you will see letter A is not the answer because when you have a 60-year-old client with end-stage renal disease who reports insomnia, muscle cramping, those are problems that are related to the disease. That is something that we need to attend to, definitely, but it is not something that is life-threatening at this time. And difficulty urination, of course, you have an end-stage renal disease patient, so definitely there will be scanty urination for that patient, especially is advanced renal failure. Then letter B, you have bladder cancer who reports persistent blood in the urine. Well, bladder cancer is characterized by painless hematuria, so definitely you can see that blood in the urine. And then, of course, you have to look at letter B as well because the patient may develop anemia in the long run. However, when you compare all of those unstable patients, letter D comes first, okay? Letter C, why is C not the answer? Because that is kind of like somebody said, because letter C, Angeli said, it's kind of like expected. Yes, it is. It's not really very high creatinine level. The normal creatinine level is somewhere in the 0.6 to 1.2 or 1.3. It really varies for males and females. And 1.8, you have to remember that these patients who are scheduled for hemodialysis, the reason why they're scheduled is because they may have a high level of creatinine and BUN, which is part of the renal failure. Okay, so very good, everybody, for getting the right answer on this. The answer is going to be letter D. Congratulations. Okay, so yes. Okay, very good, everyone. Okay, so what did you learn so far? Okay, very good. Are you ready for our delegation questions, everybody? Are you ready for our delegation questions? So our delegation questions now is about urinary system again. So let's have the question, everyone. Okay, the registered nurse and unlicensed assisted personnel who works together to care for a client who underwent kidney transplant. Which of the following tasks may be delegated to the UAP? A. Inform the client regarding strenuous activities to avoid after discharge. B. Explain the importance of taking immunosuppressive drugs. C. Assist the client in planning for follow-up appointments. Or D. Measure the client's intake and output for the shift. Okay, so which one can you delegate to the UAP? All right. Which one can you delegate to the UAP? Okay, is it A, inform the client regarding strenuous activities to avoid after discharge? B, explain the importance of taking immunosuppressive drugs? C, assist the client in planning for follow-up appointments? Or letter D, measure the client's intake and output for the shift? Okay, all right, so most of you have the same answers, and let's see if that's going to be the same answer for everyone. So meaning that you're all doing very well if in case. Wow, so these are the same students who have been attending every week, and I think they're getting better and better and better with their delegation and prioritization concepts. Okay, so the answer is going to be letter. Franz, thank you very much for being here tonight. Okay, so Maria Menjola also is here tonight. Thank you. Okay. Do not delegate what you can eat, evaluate, assess, and also what? Teach. And there's one thing that I would like to add to that. Do not also delegate. Write this down, everyone. Do not delegate planning. Okay. Do not delegate planning. Do not delegate planning, everyone, or plan. So you have your EAT. So evaluate, assessment, and teaching. So letter A, okay, so let's see what's the answer to this question. Are you ready, everyone? The answer to this question is going to be letter. Okay, very good. Letter D is the answer to the question, everybody. Congratulations. Okay, so Audrey said that ABCs for RN involves discharge teaching. Very good. So informing the client regarding strenuous activities to avoid after discharge is, of course, the responsibility of the RN. Especially patients may need to avoid lifting more than 10 pounds in the next few weeks. Okay. Letter B, explaining the importance is a form of teaching, especially you're talking about immunosuppressive medications. Okay. Letter C, assisting the client in planning for follow-up appointments. Follow-up appointments, planning, definitely that would be for the RN or licensed nurse. And letter D, measuring the client's intake and output is the answer. Okay. So the UAP can get the information, can measure the intake and output, and report that to the RN. But the RN is the one responsible for interpreting, analyzing, and synthesizing the information and decide what is the problem of the patient. Okay? So very good. Routine tasks. You're all doing great, everyone. So hi, Benedicta. How are you? Very good. Okay? So thanks for your rational, everyone. Are you ready for our last question for tonight? Okay? For tonight, okay, we're gonna have last question. Everybody, I know you're all excited. And again, just a reminder, everybody, our winner for the 90-day NCLEX review online, that will be announced next week during our Facebook Live. Okay, so if you're here tonight, then you have to join next week so that you will know if you are the one who won. Okay, so let's proceed. Last question for tonight. Very exciting delegation question, everybody. So let's see if you can answer this question. Which of the following tasks may be delegated to the licensed practical nurse when caring for a client with kidney stones? A. Administer intravenous morphine sulfate to treat renal colic. B. Monitor the client's urine for hematuria. C. Revise the nursing care plan if pain management is not successful. Or D. Educate the client on the importance of straining the urine. Okay? What's the answer, guys? Which of the following tasks may be delegated to the licensed practical nurse when caring for a client with kidney stones? A. Administer intravenous morphine sulfate to treat renal colic. B. Monitor the client's urine for hematuria. C. Revise the nursing care plan if management is not successful. Or D. Educate the client on the importance of straining the urine. So it seems like a challenging question for all of you guys. Okay. All right. All right. So let's see. What's your answer, guys? And can you please give the rationale for your answer, everybody? What's the rationale for your answer? This is exciting. Okay. Okay, everyone. Let's see your answer, everybody. A lot of people are answering. Very good. Okay, so let's see. All right. So you better watch all of the YouTube videos that we have for this one. Okay. So the answer is going to be, all right, so we have different answers to this question, everybody, but I really put this question over here and I was really very careful in making this question because I know that this is something that some students may not be familiar with, okay? So the answer is going to be letter. Let's see, everyone. You should be very happy if you got this right, everyone, but it's understandable if you didn't because this is something that some students may not be aware of, okay? So the answer to this question is going to be letter. Yes, letter B is the answer, everyone. Monitor the client's urine for hematuria. Very good. Okay, so again, what are the rules of delegation? Number one is scope of practice, stable patient, okay, and for the LPN, you don't want to say simple routine for LVN or for LPNs because simple routine is something for UAP. So for the LPN, when the RN delegates to the LPN, it has to be within the scope of practice. It has to be stable patient, okay. And the last one, is it within the skill of that LPN. And also remember, everybody, that part of delegation as well is the right supervision and direction as well. It's very important that when the RN delegates to the UAP or the LPN delegates to the UAP, it has to be the right communication, the right direction. There should be no confusion, okay, in terms of delegation. It has to be the right instruction. And also the one who delegates needs to have the time to supervise and to check, if the delegated task is happening. Okay, so maybe after an hour or 2 hours, you have to really check the person if the task that you delegated is really happening, and to confirm if the person is really understanding what is going on. Okay, always remember that when you delegate, you are still responsible. Okay, so the answer is letter B because, okay, let's have the okay, so so Menchi said, I get the strategies of answering because I watched from the beginning. Thank you. Okay, thank you very much. Okay, so Audrey said LPNs can do focus assessment, just as example, auscultation, and vowel sound. Somehow it is the same with letter B. And that's exactly correct, Audrey. Okay, always remember this, complete and comprehensive assessment. Okay, overall nursing diagnosis and analysis and interpretation, that's for the registered nurse. Always remember that, guys. But the LPNs are trained to do focus assessment or specific assessments. Write that down, everyone. Focused or specific assessment. That's part of the scope of practice of the LPN. As long as the patient is stable. Did you get me? As long as the patient is stable. Okay? So focus or specific assessment, for example, counting the heart rate, auscultating bowel sounds, checking the color of urine, checking the color of the stool from the ostomy. Did you get me? Those are examples of focused assessment. Okay? Now, in the NCLEX, if it says comprehensive pain assessment, that would be the registered nurse. Okay? But focused assessment, that would be your LPN. And the source of that is not me. Specific assessment and focused assessment is from the different sources that I read. Okay, so it's from the position statement from the National Council for State Boards of Nursing. LPNs can do focus assessment. Okay, but at the end of the day as well, you have to check the Nursing Practice Act scope of practice of the LPN. Generally, in the NCLEX, letter A is wrong because LPNs cannot do intravenous medications. Nothing intravenous in the NCLEX for the LPNs. Okay, intravenous medication, no central line management. Letter C, revising the care plan. Anything to do with the care plan and the nursing process, okay, that has to be the registered nurse, especially revising and evaluating the care plan, okay? The LPN can carry out interventions in the care plan, but the LPN cannot revise the care plan. The registered nurse can put down anything there in the care plan, and the LPN can carry that out. And the LPN can suggest interventions to the care plan. But at the end of the day, the registered nurse is the one who formulates, is the one who creates, is the one who develops the nursing care plan, okay, as well as the revision of the care plan. And initial comprehensive assessment should always be the responsibility of the registered nurse. Okay, so I hope that I cleared your minds tonight when it comes to assessment, like RN and LPN. Okay, because sometimes you will say LPNs are not supposed to assess, but then that's part of nursing school. LPNs can assess as long as it's a focus assessment. Okay, LPNs can do focus assessment. UAP can gather information. UAP can check vital signs. Okay, but UAP are not in a position to interpret the vital sign and determine what's the problem of the patient. They can just report the vital sign to the registered nurse. Okay, so letter D, educating. Of course, educating is the responsibility of the RN, especially discharge teaching, teaching a client for the first time. That's going to be RN. LPNs can teach, but it has to be reinforcement only. Okay, reinforcement only. Okay, for example, simple blood sugar checks, that could be a responsibility of the LPN, just to remind the patient, okay, how to check the blood sugar. Simple education, reinforcement. Okay, so very good, everyone. So What have you learned so far tonight, everyone? Okay, so Renali Ann said, well explained. Thank you very much. So thank you, Renali. I want all of my students to get out of my NCLEX review program really understanding the scope of delegation and prioritization. And actually, I'm coming up with my book and workbook for this topic, so you have to watch out soon. So I hope I have the time to sit down and finish that workbook because I want my students to be experts in this as well. Thank you very much. Okay. So for tonight, can you please write down what is the most interesting information that you liked or learned tonight? What is the most interesting information, everyone? Okay. Can you write that down? What's the most important information? What did you like tonight? Okay. And also, just a very quick announcement, everyone. In our Matus Nursing Review Online NCLEX Academy, we are selling masks, everybody. So we're offering free 30-day NCLEX review if you buy the mask. Okay, so get that merchandise, everyone. We have different designs, okay, with our logo, and be part of the Matus tribe. All right. Then another one, just another announcement. Of course, we have the U World now. Okay. So the most complete, innovative, and interactive online NCLEX review is Matus Nursing Review Online NCLEX Academy, and we offer a lot of value to students who enroll in our program. Um, Up to 12 months of unlimited online access to all students who enroll in the program. So 12 months, that's really very long access to watch all of the videos. And then also, we have UWorld now. And of course, our flagship for this program is going to be our my workbook. So I have my workbook here, everyone, for students who are doing self-study. So this is a workbook. It's a lot of pages, and while watching the video, you will be writing this workbook. And when I send you this workbook, I'm gonna sign it. Promise. I'm gonna put an inspirational note for all of you guys when I send the workbook if you enroll in the program. Okay. And also, okay, so another one, last one is, I know that all of you know that I have a book in Amazon and also Barnes& and Noble, everyone. I have my Simple, Fast, and Easy NCLEX review in Amazon and Barnes& and Noble. So you can order that, guys. The Kindle version right now is for sale. It's only $7.79. Okay? So thank you very much, everyone. But let's see what is the one thing that you have learned tonight. Don't delegate what you can eat and plan. Very good. Okay. What else? SSS. So Erica said SSS, stable, scope of practice, simple task for the UAP. RNs to delegate to the UAP, LPNs, no IV, central line, and care plan revising, RN only. Very good. Okay. So always on my head, the three S's every time I say delegation and no plan for LPN. The three S's applies to the UAP, okay? Especially when you talk about simple and routine, okay? So, very good, everybody. So guys, thank you very much. I would like you to join next week, okay? And see who wins our free NCLEX review. And lastly, Audrey, again, you said that it's not just the knowledge that you impart us, you also make us confident in taking the NCLEX. Well, thank you very much for that, okay? So it's all about making a difference, service, and innovation in our program. Thank you very much, everyone, and I will see you again next week. Take care.